That New York Times report claims the hospital system put profit over the quality of health care that poor patients received. Tyler Lane breaks down the report.
I have just like a really sick feeling in my stomach.
For this local woman who wants to remain anonymous, reading a New York Times investigation into the Bon Secours healthcare system,
It felt like a punch in the gut.
The article, titled Profits Over People, references many former and current employees of Richmond Community Hospital in the city's East End, alleging its owner, Bon Secours, has slashed critical resources from the hospital over the years. This, even though the Times reports Bon Secours makes hundreds of millions in profits off Richmond Community through a lucrative drug program called 340B. It allows nonprofit hospitals that serve low-income communities to buy medication for half the cost and still bill patients and insurance companies close to full price. The incentive is that Bon Secours would then use those savings to invest back into the facility and the disadvantaged area that it serves. But workers tell the Times much of the money doesn't go to those efforts, and Community Hospital lacks basic tools and support to treat patients.
And that it's just essentially an ER with very limited supplies and equipment. Yeah, my heart breaks for the people in that community.
This woman has a family member who receives expensive infusions from Bon Secours' St. Mary's location in Henrico's West End. But after the story broke, she noticed on paperwork the outpatient infusion center listed as Richmond Community Hospital.
We've never set foot on Richmond Community Hospital. I couldn't even tell you where it was until I read the article that came out. So feels a bit like we're being taken advantage of.
If you look right here, it says Richmond Community Hospital.
Looking back at her bill, Mel Brewitt has questions too. She received a $1,000 infusion at St. Mary's, but paperwork shows that services were provided at Community Hospital on North 28th Street.
So it was really confusing to see that.
Both women question if their treatment is being bought at a cheaper price through the federal program at Community, while they're being charged full price for it at another Bon Secours location.
I really hope Bon Secours takes this time to own up to their actions and can fix the pain that they've already inflicted. They are a hospital. They should be helping people, not further hurting people that go there to seek help.
Now, I did reach out to Bon Secours with several questions related to this story today. They tell me they are in receipt of those questions and actively working on a response, so I'll have that for you on WTVR.com once I get it. Now, meanwhile, my colleague Melissa Hippolyte has been reaching out to lawmakers to see if any legislative action needs to be taken on that federal drug program. And Melissa, what are you finding out?
Well, Tyler, as you mentioned, the federal program in question here is the 340B drug pricing program. It allows hospitals to purchase drugs at a large discount and then use the savings to provide services to low-income and uninsured patients. Now, this program has existed since 1992, and Congresswoman Abigail Spanberger co-authored a letter to the Health and Human Services Secretary in January of this year expressing her support for the program and urging faster enforcement action against drug companies that overcharge 340B hospitals. However, the New York Times investigation, which highlights Bon Secours not using the savings to help underserved populations, is putting new scrutiny on this program. We asked some of our federal lawmakers for their reaction to what is happening. Congresswoman Spanberger's office said she is deeply troubled by the reports that Bon Secours Mercy Health System has not lived up to its commitment to the city of Richmond, federal government, and the community's Richmond Community Hospital services. She will always support additional oversight of federal programs and tax benefits to ensure not-for-profits are meeting commitments to the communities they serve. Now, Congressman Donald McEachin's office said he is concerned about the reports on Bon Secours and is currently looking into various avenues of federal oversight or legislative action. Well, Senator Tim Kaine happened to be in town today, so we caught up with him and asked him for his thoughts on the investigation.
The thought that somebody might be using this program as kind of a profit center rather than to really help people was very, very troubling. So we need to, we always got to make sure you hear a response before you decide what to do. But I think Bon Secours owes everybody an answer on this.
Now, in a statement, Virginia's other senator, Mark Warner, said it is disheartening to see hospitals and health systems reaping the benefits of this law while letting down the communities they are supposed to serve. While there is no quick fix to this problem, I welcome increased scrutiny, and I believe Congress must act to ensure that the integrity of this program is upheld. To read the full statements of all of these legislators, visit this story on our website or the WTVR app. Working for you tonight in Richmond, I'm Melissa Hippolyte for CBS 6.